Now, about the week academic, the world the epic scored by Albert Stanley. Oes o iawn i chi fydd cyfarfod wedi bod yn adolfod. Diolch I gyd am eich amser. Good afternoon, everyone. I'm Jack Williams. I'm chair of the board of Swansea Bay University Health Board, and a very warm welcome to this afternoon's annual general day. I want to say a particular welcome to our guests. We have Pat Dunmore and Mina Williams from our stakeholder reference group. We have Amy English from Schweiz, and we have Teresa Obiekulu, to my far right, who has just been appointed as the Associate Board Member for Inclusion and Belonging. So croeso mawr I chi gyd. So thank you very much for joining us this afternoon. The annual general meeting is an important way in which we demonstrate our commitment to openness, transparency, and the way in which we hold ourselves accountable. It gives us the opportunity to share and reflect on the year that's passed, what we've done well, the challenges we've faced, and then our plans for the future. So this afternoon, we're presenting highlights from our annual report and accounts for the year 2025-26. And we'll hear from members of the executive team about the performance of the Health Board over the past year. We will also give people the opportunity for questions and discussion. But before we begin, on behalf of the board, I would like to recognise and thank all our staff. Throughout the year, they have continued to demonstrate consummate professionalism, dedication and compassion in serving the people of Swansea, Newport Talbot, and the wider communities and populations who depend on our specialist services. And as a board, we want to pay particular tribute to staff working in the period of extreme heat we've been experiencing recently. They really have gone above and beyond what we could reasonably expect of them in maintaining it. So 2026, it seems since progress in a number of important areas. We've reduced waiting times in several specialties as we're here, increased the number of outpatient appointments available, and continued to develop services closer to home that are so important to people. But at the same time, as a board, we remain very conscious of the challenges we face. The pressures within urgent and emergency care, cancer services performance, maternity and neonatal services, mental health services, and of course, the significant financial challenges that we face in common with the NHS across the country. So our annual report sets out to give a balanced account where we've done well and where we know that we need to do better. We set out to be honest about where we made progress, where we have fallen short of expectations, and what we're doing in response, because we do have the ambition to be a high-performing organisation and to provide the very best services we can for the people that we serve. So the partnership remains central to our success. We work very closely with our local authority partners, our third sector, our primary care providers, our neighbouring health board, and our community to really improve health outcomes and tackle inequalities across the population. As the chair and the chief exec, we are proud of the commitment that our board members show and our staff show. We are equally clear, however, that we must maintain our focus on delivering sustainable improvements to patients, improving access to services, reducing health inequalities, and ensuring that every pound of the £1.8 billion of public funding for which we stewards is used for the greatest possible value. So the annual general meeting is not only an opportunity for us to report back on the past year, but it's also an opportunity to listen. We welcome your feedback, we welcome your questions and your challenge as we continue our journey of improvement. So diolch unwaith eto am ymuno â ni yn aml. So thank you once again for joining me. Before I turn to Abby Harris, our Chief Executive, just record the apologies from board members, please, Hazel. So we have Charlotte Rees, Jean Church, Nuria Zolney, Nicola Matthews, Bryce, all independent members, then Alison Clark, Deputy Director of Therapy and Health Science, Deb Lewis, Chief Operating Officer, and we welcome Craig as the Deputy. So on that point, Abby, may I now invite you to give your reflections on 25-26.
Thank you very much indeed for that introduction. And just very briefly, want to echo my thanks to the colleagues right across the organisation. Day in, day out, they do an extraordinary job in meeting the needs of our patients and supporting our local communities. And the other thanks I wanted to make is to our patients. So every day, pretty much, I get some communication from the patients in my inbox. And sometimes that's that complaint or something we haven't got right. And what we always talk about is that those are real important opportunities for us to think about how we can improve our services. But I also get many opportunities where people are writing to thank us very much for the support that we're providing. And I know that in the way that we get feedback from our patients, we have very extensive feedback. And each opportunity that we have for a patient who gives us that feedback, it's an opportunity to reflect and learn and celebrate where staff and are acknowledged as part of their contribution to patients' experience. And I had the benefit this morning of being in the joint commissioning board meeting, and the patient story that was used was Swansea Bay patients. And it was fantastic to hear a Welsh language speaker, importance of Welsh language in delivering our services. We'll bring that back to the board and share that with, but it was a really important opportunity to think about what's happening on people's lives. Next slide, please, Paris. I think you're really good. So 25 to 26 was an important year on our journey for improvements and wanting to become the high performing organisation that we set ourselves as our ambition. We have spent a year where we have seen significant strengthening of the organisation during the course of the year, and recognise that as we finish the first quarter of 26-27, we still have big challenges ahead in the organisation. As I mentioned, we've got dedicated teams right across the organisation. This has just spent time with a number of visitors this morning who came to see some of the work that we've been doing here in Bolson's and other wards that are really about enabling and empowering our teams at the front line to deliver improvements in the services and getting a sort of a win-win-win, which is actually better outcomes for patients, better value in terms of using our resources, and better outcomes in terms of our staff experience as well. And we've got many examples across the organisation where we've seen our teams driving our improvements. We're doing more work to build on that quality improvement methodology right across the organisation, so we're really clear on what is the Swansea way of driving our improvements, recognising that there are tools and techniques that we can utilise to continue on that journey. Some of the highlights for the year, colleagues will be very aware that the new government that's now been in place a little while has reiterated the commitment to planned care. We know that many patients are still waiting too long to access planned care. We've still got the impact of the pandemic and that period of pausing many of the planned care activity lines during that period. But it's really fantastic to see that as Calpol, we've made significant progress in terms of bringing those long waits down. We've been able to maintain that in the first quarter of this year. And so we've seen shorter waits and better access to our patients. That has been a remarkable achievement through additional activity. So we've done in excess of 25,000 additional outpatient appointments through a combination of our own internal capacity and external capacity that we have delivered. And as you can see in some of the specialties, we've seen a really significant reduction in those long waits. We are really committed to maintaining that, and we've been working very closely with Welsh Government and NHSP and I to develop our plan for this year that will capitalise on the additional funding Welsh Government is making available to support that work. And of course, early diagnosis and getting access to timely treatment is really important, not just primary care, but around cancer as well. And cancer is one of the areas where our performance in 25-26 wasn't as good as it needs to be, and we would want it to be for our patients. So focus on that in this financial year. Next slide, please, Karis. Colleagues will be very aware that we've had an ongoing focus on emergency and urgent care. Colleagues will probably recall the board meeting where we talked to some of the staff, colleagues from the emergency departments about their experience, knowing that they're not always delivering timely access. And we know that where we've got delays, patients can come to harm if they're not receiving care in a timely way. It is still an area that remains a challenge to us, and we have made progress across most of the indicators. And our work at the moment is to make sure that we consolidate that and that we continue to improve on that. So there are inconsistencies across the 7 days in the week that we need to address, so that the periods right across the 7 days is as good as it possibly can be for our patients, and that we are ensuring that the acute pathway is timely so that patients get back home quickly after an acute episode, working very closely with the local authority colleagues to make sure that we enable that to happen. So this is an area that we are making progress, and it does remain a challenge for us, and you will see that reflected in the 26-27 plan very explicitly. Next slide, please, Karis. Colleagues will also be aware that we are continuing our improvement journey around financial sustainability. We made progress in the last financial year and ended the year in a slightly better position than we were expecting to, because we were able to use some non-recurrent positions to help at the end of the year. But we are addressing a significant underlying deficit. It's around 100 million. We've had external partners supporting us in terms of helping us understand the drivers of our deficits and helping us develop a credible and stretching and deliverable improvement programme for the financial position. And that carries on to 26-27. And that's characterised by making sure that we keep a laser sharp focus on equality and safety. We do know that safe and high quality services generally cost us less, and that we keep that focus on making the right decisions and to protect frontline services. But it does require us to be very disciplined around how we set our budgets, use our resources, and ensure that we are reducing variation in the way that we utilise our funding. So, Jen, as you said, part of the introduction, we have 1.8 billion of expenditure a year, and we need to make sure that as custodians of that resource, that we are able to evidence that we are getting very best value out of that funding for our population and the wider populations that we serve. That does require us to make difficult decisions at times in terms of where we prioritise and where we focus our delivery, and some decisions about slowing some things down or stopping some things which are difficult at times, and including right-sizing the workforce. So we know that workforce has grown significantly over the last 5 years, and some of that is really clear why that's happened. But for us moving forward in a sustainable way, we need to make sure that we are really utilising opportunities for delivering services in the most effective way. Next slide, please, Karis. So we've described this financial year just gone as kind of building the foundations that we need to be a highly effective and high-performing organisation. And in terms of some of the pillars that we strengthened during the last year, a couple of things were really important to us. So one was around the organisation strategy, and we'll hear more about that a bit later on. The second is around really strengthening our clinical services plan, updating and refreshing that, and evolving our plan for sustainability into the future, and shifting towards sort of short-term transactions that enable us to improve our financial position to long-term sustainability of our services. And that we are on that journey of transition. And this year in 26-27 will be fundamental in terms of our shift to becoming a sustainable organisation. I've already talked about the dedication of our staff and patients, and we just come from a very constructive meeting with our stakeholder reference group, where we have really strengthened the partnership working and really utilising that mechanism to engage with patients in our communities in a deeper and more meaningful way to help us shape and inform the services moving forward. We're not an island, so Jeremy talked about the partnership with neighbouring health boards and recognise that we've also been establishing new relationships with key colleagues in Welsh Government and with NHS performance and improvement, which has got a new managing director and a new operating framework, and we're working that through at the moment. And I guess what's fundamental overall is about thinking around the population that we serve. We know from the work that Jill Richardson did and that Hugo is continuing in public health around the health inequities that exist in our population and our commitment to work really hard to focus our efforts to make sure that we are reducing those health inequities so that everybody has a chance of living a healthy life and that we're enabling people to access opportunities for improving health through screening, vaccination, earlier diagnosis and early intervention as part of that programme of work. Next slide, please. So I touched upon the organisation strategy and I'm really grateful that we've really led earlier on in 25-26 to refresh the strategy. When I came into the organisation, we had slightly cluttered environment around the organisation strategy. There was lots of really good work, but I think we were not crystal clear in terms of the overarching vision that we had for the organisation and the explicit organisational objectives that we were setting that give us the direction and the North Star for the organisation in the next 5-10 years. Next slide, please, Karen. So what you see, we've engaged colleagues and had feedback around the organisational strategy. I think it was July in 25-26. It's like quite a long time ago now. Next slide, please, Karen. It was an opportunity for us to crystallise our vision and wanting to ensure that we create a healthier future for everyone in our community, reflecting what I was just saying about the health inequities that exist, and that we categorise that around healthy, happy lives, where people are able to live as independently for as long as possible, and that in terms of our responsibility for providing care, we are ensuring that that is high quality care that can be accessed when people most need it in their lives. Next slide, please. I'm not going to go through this in detail, but again, it was an opportunity for us to refresh our mission, better health, better care, better lives. And the slide there gives you the articulation of what that means to us in our communities and our colleagues right across the organisation. Next slide, please, Karen. I talked about being a slightly cluttered landscape in terms of all of our interconnected organisational strategic plans. And what we've done is a significant piece of work to make sure that all of the enabling and supporting strategies or strategic plans fit together underneath the organisational strategy. Some of them have slightly different timelines, so as they get refreshed, they will be much more explicit about how they connect to driving forward our organising strategy overall. I think the cheese wheel, those who play with that game is it's not cheese, not everyone's talking about. You can see that the complex enabling programmes of work that sit underneath the strategy that will enable us to deliver against the strategic objectives that we set for ourselves, sit in a lot of those detailed programmes of work. And again, we've agreed to ensure that we're in updates to what Marie's regular report is for around where we are against each of those enabling strategies. Next. I'm going to hand over to Marie to talk about the 5 Ms. So the 5 Ms were the priorities that we were really focused on in 25-26. I've touched upon some of them, but Marie's just going to give us a bit of a quick counter through in a bit more detail on these.
Very quickly, because I think my exec colleagues who lead on each of the 5 Ms, which are loosely defined as 5 Ms, because you can see that at least 2 of them probably aren't really Ms, but we'll come at that. So you'll appreciate that these were themes that came through our processes last year as significant issues that required addressing, and they form the core of our transformation and redesign programs that we are driving through our governance within the health board, and are the kind of core foundation of our annual plan this year. So these are the 5 critical priorities that we've made a commitment as a board and as a partner in the wider systems partnership to address. So from a maternity and neonatal care perspective, we made commitments following the independent review to significantly improve the care that we were offering as a health board, and we've made good progress, but we know we've got further to go, and we have a restructured approach as to how we're going to deliver that change in partnership with our families and with our communities. And Liz will touch on that shortly after I've run through the remaining 4 M's. Mental health, again, this is not a new issue for this health board. We took a position last year that the current situation is untenable, and we have to make significant improvements, both in terms of strengthening the workforce, making those services, inpatient services, safe for patients, and addressing some of the critical environmental issues, which again Abby will just pick up briefly as a follow-on from this slide. And we are also have rolled out and will continue to roll out our digital system, which replaces an outdated system and also enables our partners to input and engage in that system as well. So some huge improvements, but again, still a long way to go, and there's a national context to that and a partnership context to that we're very cognizant of in how we drive that programme forward. Maintaining improvements in planned care. So as both Claire and Abby touched on in the introduction, we were able to deliver the Welsh Government targets in planned care from a no waits over 104 weeks and no outpatient waits over 52 weeks. It's one of the very few health boards in Wales that were able to deliver that, and we are very keen to maintain that performance position. It's not without its challenges, because we do have growing demand in a number of areas, which is going to put some pressure on our available capacity. So looking at system redesign and demand management as part of that process is really critical. And we know we've got particular challenges in diagnostics and in cancer services that are that remain challenging and are important priorities in our improvement plan. Emergency care, again, we saw some quite encouraging improvements in the middle of last financial year, but we weren't able to maintain them for a variety of reasons. But we know what it looks like, and have a clear programme plan for improvement, focusing on the immediate priorities around ambulance handovers, but again looking at the whole system redesign work that we need to do with our partners, not only with our local authorities, with our communities, voluntary sector, with WAST, and with general practice. So again, a structured programme-based approach to how we're addressing those priorities. This has now been developed and embedded. And last but not least, financial position is hugely challenging for a whole range of reasons, as Abby touched on. We've had some support to help us get underneath the bonnet, really understand what's driving the deficit position, which, as Abby said, is in excess of 100 million. That is a big challenge for this organisation to continue to deliver on the improvements in care that we need to. We will need to reallocate some of our resources, but we will have to do it in the context of an overarching reducing financial envelope. And so balancing those challenges, again, we're taking a programme approach, driving that through, but it remains a challenge this year and for the next 3. But moving into a balanced position over the next 3 years remains a priority. I'll hand over to, I think, Liz, to just do a quick review.
Yeah, so there's a few memories. 50th of July last year, we received a, I think we can all remember that, independent review, and us receiving that, which was a sobering read. And we did provide an unreserved and full apology to families affected for the failings that happened. And we continue to offer that apology. What I will say is that, along with the slice reviews that came in around patient experience, the family-led review, also the All Wales assessment that we've just had. The team, the multidisciplinary team have worked exceptionally hard on making progress and improving services. And Raj, you were at that long before I arrived, and I want to thank Raj and Marie being our board safety champion, but particularly the team. But really the oversight that the board has given to the facility and the health services, the scrutiny and the challenge has been constant and very, very welcome to help us to improve. This board now see information on the care that we give the facility and the health services that I don't think any other board sees. So that challenge, I think we have met and we continue to meet. We've made significant improvements, but there is always more to do. And we're currently in a position where we have no negative outcomes in either the facility or the services, and we want to stay that way and get better. So we've learned a huge amount, I think, over the last year since we've had that report, and we'll continue to do so. But a definite commitment and oversight from this board, which I have found extremely helpful to the lead exec and the services.
Yeah. So this is a slide that's got performance against a number of priorities, and I'm happy to pick up a separate slide on mental health.
There is. So I think that's the next slide is one.
There we go. So I'm happy to pick up where we've got on mental health services. So, as it's talked about, we've been driving the improvement through a programme approach with governance around it, and we've done the same with mental health transformation. So the drive is slightly different in terms of what we need to do to improve our mental health services. But underpinning the service was the need to look at our service model to make sure that it's fit for purpose, reflecting the national strategy that was published in 25-26, and the emerging service model that goes alongside that, making sure that we are able to deliver as much care as possible, including crisis and treatment services in a timely way, so that hospital admissions are for those patients who only receive treatment in that environment. So the fundamental health transformation programme up and running, and that really got established in 25-26. We've had the benefit of some external scrutiny and challenge through a special advisor that we've appointed to the board, who's been supporting us during 25-26 with that work. And it's a service that's been categorised as service of concern with Welsh Government as part of the escalation arrangements, but we have seen really good progress. So in relation to the service model, the service group have been working with patient service users, with local authorities, third sector, to update on the service model and move that forward, and that's making really good progress. In respect of the workforce, we knew we had some gaps in terms of safe workforce, and a comprehensive review of the workforce has been undertaken. We're working through a prioritised plan to strengthen and shore up workforce, particularly in the crisis and treatment teams in the community and the acute adult wards, where we've had high reliance on agency and variable pay rather than substantive and permanent workforce. So we're working that through at the moment too. And the quality and safety agenda has been really important. So again, Raj has done some work and led on a piece of work with the service group to look at the metrics that enable us to judge whether our services are safe and effective on a day-to-day basis in terms of are we safe today, but also in terms of what the trends are telling us in terms of the information on the safety and quality of our services. And we've made really good progress with the digital upgrades. One of the challenges we faced at the beginning is that much of the data recorded for our mental health services was captured on paper, and those paper records didn't enable us to join up across pathways or enable staff to access in a timely way their comprehensive information relating to patients and their treatment. That's progressed really quickly, and I think we've got about 650 users now on the digital system able to access that. That's enabled us to develop a digital dashboard for quality and safety, which I think is probably first in Wales, and is work that we're sharing with the National Mental Health Programme too. One of the things that remains outstanding, we talked about, we have invested £3 million to improve the ward environments, particularly again called for the 2 adult wards, but we know they remain unfit for purpose for modern mental health provision. So we have been working very closely with Welsh Government and NHS Performance and Improvement on a stabilisation plan that has been accepted by Welsh Government, and we are progressing that with a programme, a business application case this year to seek support we need to continue further improvements whilst we work with Welsh Government and NHS PNI on the long-term solution. So this has been an important programme, continues to be one of our priority focus areas for 26-27 and will continue into the following year as well. Next slide, please.
So I think this one is an exit from the plan around what we were proposing to deliver in 25-26 from a plan version. That's the perspective. And I think Craig, you're going to pick up on the
These are the grants we set out for 26, which sadly kind of captured a number of them. So we go on to the next slide, Charis. So from an emergency and emergency care perspective, it remained a challenge through 25-26. With continued pressures on performance, which you've seen in previous years. However, we did see period notable improvement of ambulance handovers and the MAG, the Ministry of Health, the advisory group recommendations around 45 handover. There was substantial operational work undertaken to support this, most notably reviews of the medical assessment model, the 7-day of the same-day emergency care, and the use of newer next patient model for continuous flow, both surgical and medical bed perspective. Next slide. From a planned care perspective, the key achievements were no patients waiting over 2 years. We've maintained that progress together with the 52-day target round outpatients. These were achieved by a combination of initiatives, increasing activity, targeted initiatives, and we work with insourcing and outsourcing organisations as well in their delivery. The focus now going into 26-27 needs to be around productivity and maximising capacity. So that'll be the key for the delivery this year, and making the most of our existing capacity. In terms of cancer, next slide, sorry. Yeah. The delivery of the single cancer pathway remains a significant challenge for us. We saw an increase in the backlog, the supplements, that's seasonal demand, particularly in relation to referrals for skin cancer, is a major contributing factor in that backlog. Fortunately, performance was well below what we would have aimed it to be, a range between 52 and 65% of the on the target 75% the year. But we did see some improvement in terms of decision to treat, focusing on the 2-week referrals, and our decision to treat was 40% within 31 days. So there were also diagnostic constraints, notably around cell plan delays, which we are addressing now in relation to the backlog that we currently have, and bringing that backlog over the next 3 months and should see improvement in performance.
Hello, I'm the interim finance director, Swansea Health Board. I'm going to summarise really the Health Board's financial duties for the year 25-26. We have 3 statutory and 1 non-statutory requirement. The first of which relates to our revenue resource performance. From the 1st of April 2014, health boards were required to ensure their expenditure does not exceed the aggregate funding allotted to it over a period of 3 years. We did not meet this requirement for the financial year 25-26. However, in relation to our capital resource performance, again, we spent within our allotted 3-year period and therefore achieved our statutory performance. We are also required to complete a 3-year integrated financial plan. And as we were unable to balance our plan within 3 years, we did not have our financial plan approved. We are currently working on our long-term financial strategy. It builds on the work that was undertaken with our external strategic support that was provided with the support of Welsh Government. We are focusing on some key areas and themes of improvement. And during 25-26, we identified the areas for improvement, and we are now implementing those improvements as part of our recovery and sustainability plan. We plan to submit this strategy, financial strategy, as part of our work in the forthcoming year. So I'll now hand over to the charity.
Okay, thank you. So I'm Richard Thomas, Director of Insight Communications and Engagement at the Health Board, and lead on the charity, working closely with Craig. So it's been a big year for the charity in terms of delivering against its strategy, its 5-year strategy. The strategy is around growing the charity, so that's in terms of growing the income and reinforcing its capacity as that income grows. Second part of the strategy is around more high impact appeals and activities. So that runs 1 or 2 major appeals a year, major events, for instance, Jiffy's bike ride, corporate partnerships, legacies, and bids for funding. The third element is around development and maintenance of a strong brand identity for the charity so that it becomes a trusted partner. The fourth is around effective digital marketing, and we've made great strides there. And the fifth around promotion of impact. So that's how we spend the money and the impact that we have. And then the sixth is around the mobilisation of staff, patients, friends and family behind the charity. And in 25-26, the income target was 800k, and the charity raised almost £1.6 million. So that was double the target. The next few slides just give some examples of what I've just talked about. So going extra mile for cancer was one of the big charity appeals that we had during 25-26. It shows there that we made 124k during that financial year. I'm pleased to say that the up-to-date figure is now approaching the 200k target, so we shortly be successful on that particular front. The other big appeal that we got is a Coach Native appeal for a sensory garden at Neath Talbot Hospital. So as the early stages of that, we've already raised almost 20k in support of that particular appeal. If I go to the next slide, please, Carys. So the first big appeal that we launched was a Coach Close appeal that we did in conjunction with Swansea City. They were a massive partner for us in terms of the way that that appeal was rolled out. And we've hit the target of 100% of the 160k. And a lot of work has been undertaken in terms of the Coach Close houses that obviously support those who have the families who have babies in the NICU in Singleton Hospital. So it's a really, really important facility for them and provides a lot of respite for those individuals. Going on to the next slide. We're developing the corporate partnership, so there's a range of different things that we're doing here, and we're in discussions with Principality about the next steps in terms of the partnership there. There's a range of different partnerships that we're developing that help us support the growth of the income that we're looking for. The next slide, please, Carys. And then coming back to making, I suppose, flagging up the impact and making sure that we have an impact across the board. There's a number of different examples where the spend of the charity is having a very real impact. One of the big projects that we're looking at right now with scoping out is here in this very hospital, where we're looking at the entrance to the hospital. Clearly, lots of patients, family visitors make use of the entrance to the hospital. So we're looking at the way in which we can better equip the seating area there, so there is a more fitting place for people to have some respite, to look after their own well-being, and obviously to weight as well. So it's a big project that we're working on. But one of many across the health board where we're looking to have a big impact. So all in all, it's been a very big year for the charity, and I think big strides forward and more to come as well.
Yeah, thank you. Next, Andrews, guys. So as I mentioned briefly earlier on, we are in the process of delivering our plan for 26-27. We've completed the first quarter of that, and that's enabled us to have a really strong focus on continuing the work around financial sustainability. That is the kind of backbone of our plan for this year, reflecting what Claire was saying about our requirement to achieve statutory and the duties and achieve financial balance. We set that out in a plan for 2027 through to 29, recognising that it will take us a number of years to achieve financial sustainability. But we are doing that in the context of balancing the importance of continuing to provide safe and effective care and treatment for our patients, and recognising that not only is it the need for toll but Swansea population 77, we provide services for many communities and much of everything. Particularly Haldar, we've got very strong partnership through the regional joint partnership committee with Haldar. So really thinking about how we can join up our pathways and where we can bring some of our services together, both backroom functions, but also thinking differently about how we ensure and even out some of the access arrangements for some of our services across the Haldar and Swansea Bay population. Colleagues will also be aware that we are one of the two big tertiary provider services in Wales alongside Cardiff and Vale. As I mentioned earlier on, I've come from the JCC meetings this morning, where we talk about some of the pressures that we've got in terms of how we continue to provide a full range of tertiary services for our population across Wales and indeed North Wales. Services like our burns and plastic services, where we are not just a regional service to South Wales, but we also provide service to South West England too. So really important we continue to work on a programme called Transforming for the Future, which is the clinical services plan that will set out how we ensure that we can maintain our services in a sustainable way, combining balancing access with critical mass that you need for delivering some of those more specialist services. We've talked already about maternity mental health services having improved significantly, and they will continue and do continue to be priorities for us this year. And as mentioned, next week's board meeting is an important milestone in the maternity and neonatal improvement journey, and we're also bringing an update on the mental health transformation programme as well. We continue to focus on both the balance for the in-year improvements that we want to make, while setting ourselves up to be successful in years 2, 3, 4 and 5. One of the programmes, one of the other programmes that we've got, which is an enabling programme, is around making sure that we are organising ourselves effectively in the organisation. So we've got a programme called Organised for Success, and that really is about making sure that every staff member, every colleague across the organisation is equipped to do their job effectively, and that we've got the right organisational shape and structure. So we are moving from the current service group model to a care group model, that enables us to have a specific care group for children, women and families, and will enable us to strengthen some of the pathway working where patients travelling across our individual hospital portfolio as part of their journey of care. That's working through at the moment, and alongside that we're doing a lot to support staff through training. So alongside the financial plan, we've done a lot of work to support managers who manage a budget, to make sure that they have the skills and capabilities that they need, and we're making sure that quality improvements methodology is really being embedded. And this team have done a lot of work. We've got an excellent clinical lead, one of our consultants who leads that programme of work, and again making sure that we strengthen that and embed that in as part of our organisation. Really key that we think about how we measure outcomes. So we have a big programme of something called Problems and Friends, which is about how we record the outcomes from a patient point of view, and making sure, particularly as we move to a sort of outpatient programme, which is only come back as a follow-up, absolutely need to, And actually, as much as possible, that should be initiated by the patient. You know your condition, let's give you the triggers that if you do need to come back into the system and see again, and that's initiated by the patients, often patient-initiated follow-up. So really looking about our outcome data and making sure that that is driving the conversation about our services safe and giving us the outcomes that we would expect from the investment that we're making. The continued focus on making sure that the money, public money, that's taxpayers' money, is really giving us the very best outcome. And again, that goes back to what I was saying about difficult choices and focus about making sure that we are as effective and as efficient as possible. And so that efficiency and productivity, as we call it, making sure that for each units of investment that we're putting in, whether that's staff result, clinic results, that we're making sure that we're utilising that to very best effect, and that continues to be really an important focus. Big running through our plan this year. Next slide, please. Again.
Thank you very much, Abby. So that is a very quick run through of 25-26 and a look ahead into 26-27, where we are now, of course. So we do give the opportunity to anybody watching online or in the room to ask any questions. Richard, have we had anything online?
No, there's nothing on that, Chair.
Right, thank you. So do we have any questions in the room? Amy, would you like to say anything on behalf of Clive?
Thank you for inviting me. First of all, it's great to be here. I've been covering as interim regional director since the end of April. Not quite sure how long I'll be here yet, but really looking forward to working with you for however long I'm here going forward.
Thank you.
Well done for a good year with all the challenges, I would say.
Thank you. And we look forward to working with you as well. Do we have any other questions or comments? No, if not, then I'll move to my closing remarks. So we do hope that this afternoon we've demonstrated to you that we do have the ambition and the determination to become a high-performing board and organisation that provides the very best care for our population and helps reduce health inequality. We take all of our stewardship responsibilities very seriously, and we hope that has come. We've made significant progress on a number of fronts in 25-26, and we reiterate our thanks to all our staff for their hard work and their commitment day in, day out. We are proud of you all. We know that we have work to do to get on top of the challenges that we face and that we set out honestly for you today. And our commitment as a board is to focus relentlessly on those challenges every day so that we become the best we can be. As the chair of the board, I'm privileged to have alongside me members who all work as one unitary board to achieve progress and to work towards performance and excellence. And I am fortunate indeed to work alongside a chief executive who is an inspirational leader. Now, we have one board member who won't be with us next year and to whom we'll say a formal farewell next week at the board. But I can't let the AGM go by without saying to Win a very big thank you for your convo. After a very long, distinguished professional career, Rena, you've applied the same dedication, determination and purpose to your independent career. We have been fortunate indeed to have the benefit of our expertise for 8 years. The board will be poorer without you. We thank you for everything that you've done, and we are so going to miss you. And this is only a warm up for what next week.
Thank you.
So dyma diwedd y cyfarfod nawr. Diolch yn fawr eto am ymuno â ni. So thank you all very much for joining us. That's the end of the meeting and showing the staff now. Safe journey home and goodbye for now.